There's some big changes coming to Medicare starting in 2023, and I'm going to explain how these changes will affect you as a Medicare beneficiary. The first change we'll discuss are the updates to Part D prescription drug coverage. With the passage of the recent Inflation Reduction Act, there'll be lower prescription drug costs, and that's good news for everyone on Medicare. This will apply whether you have a standalone Part D drug plan or a Medicare Advantage plan that includes drug coverage in it. Here's a helpful chart from the Kaiser Foundation that gives a timeline of when these changes will occur. Starting in 2023, there will be set limits on drug prices. The new law will also expand the coverage of insulin and limit copays at $35 with no deductibles for Part D and Part B covered insulins, and adult vaccines will be covered 100%. Cost sharing for vaccines will be eliminated under Medicare Part D and Medicaid, including the shingles and pneumonia vaccine. Currently, the shingles vaccine can cost between $100 to $300 for both shots, so this will be a relief for seniors not having to pay that. In 2024, the 5% coinsurance for catastrophic level coverage in Part D is going to be eliminated, and the Extra Help Part D assistance program will be expanded. Those who are now getting partial extra help with income from 135 to 150% of the federal poverty level will now be moved to the full extra help level. The income and asset thresholds will be going up, so more people will be able to qualify for this program, which is great news. From 2024 to 2030, there will be limits of 6% annual increases to Part D monthly premiums. In 2025, there will be a cap of $2,000 on Part D prescription out-of-pocket spending, and you'll be allowed to spread out the out-of-pocket costs over the year. In 2026 and 2027, the government will begin price negotiations with manufacturers of certain eligible high-cost brand name Part D drugs. And in 2028 and 2029, they will include negotiations for Part B drugs as well. Part D medications are usually your day-to-day medications that you have filled at your pharmacy, and Part B medications are typically administered at an outpatient facility or in a doctor's office. Some other changes that are happening in 2023 are updates to the Medicare enrollment periods. The first one is for the Part B enrollment period. Starting in 2023, the government will make it easier to enroll in Medicare to reduce any gaps in coverage. With the current rules, the effective date for your Medicare Part B depends on when you enroll. So if an individual enrolls in Medicare in the first 3 months of eligibility, then the coverage will be effective on the first month you're eligible to start Medicare, say the first of the month you turn 65. And if you were to enroll in the actual month that you're eligible, then your coverage won't start until the next month. And if you apply after that, say in the next 2 to 3 months, then you'll wait 2 to 3 months longer before your Medicare coverage begins. Under the new rules in 2023, if you're applying during those last 3 months of your initial window, the Medicare Part B coverage will be effective the next month after you enroll. Another change happening is to the general enrollment period. The way it is now, if you missed your initial Medicare sign-up window, then you'd sign up during the general enrollment period, which runs from January 1st to March 31st. You wouldn't be able to get Part B coverage until July 1st of that year. And with the new rules starting in 2023, if you have to apply during the general enrollment period from January to March, your coverage will start the next month after you apply. You don't have to wait until July 1st for coverage to start. If you have to use the general enrollment period, you could also have penalties associated with your Medicare costs. The government will also allow special enrollment periods for people who have exceptional conditions and were unable to enroll during the Medicare enrollment periods. But it's always best to apply during the periods when you won't be subject to any penalties. There's also some talk about the Medicare Part B premiums going down for 2023, and as it stands now, costs for Part B, which is based on your income, starts at $170.10 a month. So we should know more around November when CMS releases the Medicare premiums and deductibles for the new year. If you have any questions, please call or email us. Our service is 100% free, and we're happy to help you. If you like this video, please give it a thumbs up and be sure to watch our other videos to help you better understand your Medicare.